Today I'm going to be demonstrating how to set up and break down the Hygiene air polisher, the airflow. I'm not going to be doing a demonstration on how to use it because there are lots of videos online for that. So first I'm going to go over the differences between the two handies that we have. We have the pink and the blue. The blue is, I guess they would consider their standard tip. The pink is their Perio one. As far as powders that can be used in the blue, technically, according to Hygiene, all of them can be used. It is optimal to use the classic powder. Yes, the classic powder for the blue, and it comes in a variety of flavors, I think 4 flavors. And it says acceptable to use the Perio and the Plus powder in the blue. In the pink, you can only use the Perio and the Plus powder. Do not use the classic powders in the pink. They also have different tips. When you go to use the tip for the blue, it looks very similar to this one if you look at just the tips, but these actually are labeled differently. The one that has the plus sign goes with the pink handy. The one that does not have the plus sign goes with the blue. If you try to connect the pink, the one with the plus sign, to the blue handy, it will not go on. So it clicks on into place, it swivels, but it is on there. Same with the plus sign, you attach it, it clicks into place, swivels. The pink one also has a second, it looks like a little snub nose. You can see the differences with them. In order to use this one, you have to use it with a plastic Perio nozzle. They look like this, they are in each of the pink handy boxes, and they are disposable. So new one each time for a patient. To put this nozzle on, you are going to hold it so that you're reading the words airflow, that they're not upside down. And you start where there's it almost looks like a bird's beak. There's a little curve to it there at the top. And you go from the top. Nope, wait a minute. Didn't I do it from the top before? Mm-hmm. We're gonna go from the bottom this time. I lied, we're gonna go this way. Okay, aiming downward, and you push until it goes into place. If you have to give it a little tap in there on the counter, but that's how it looks once it's inserted. That's for the Perio insertion. To remove this when you're done, you use this little wrench, which should be in each of the bins. You insert it, kind of like a bottle opener, and then you tip up, and the plastic comes off, and you throw that away. That's how you work those. Okay, so that's the differences between the two hand pieces and their tips. The very first thing you're going to do at the start of the day, and in case you ever forget what is what on your unit thing, everyone has a nice laminated sheet, and it's the second one from the right is for the ProfiJet. So we're going to use this one, and then to adjust the water, these buttons all correspond to these hand pieces. So second one from the right, this is going to control the water flow to this hose. Never, ever, ever adjust the air pressure. You would have to open this up and do things you're not supposed to do. All of these are preset to the air pressure that they need to be to work with this. So you're only going to mess with the water. So the very first thing you're going to do, since it's the start of the day, is you're going to purge your lines for 2 minutes. On your rheostat, you're going to flip this little switch to the blue dot. That blue dot indicates water. And then you will spray and make sure we get water. I just filled up the bottle, so it may not come out yet. And if there's no water coming out, it might be turned off all the way like this one is right now. So you're going to open it up, lefty-loosey. And I have water, so I'm going to let this run for 2 minutes, and that is purging my line at the start of the day. You only have to do this once. So if you're in private practice and you're using the air polisher on all your patients throughout the day, the purging of the line is just the one time at the beginning, and then you can do, just like the Cabochon, the 30 seconds in between. Okay, can I pretend like we did? We're going to pretend like 2 minutes has gone by. Woohoo! Okay. All right, so now to actually set up your air polisher. before you connect a handy to your hose, you're going to go back to air only, and you're going to push on the rheostat until you are sure that you are only getting air out of your handpiece. So no water whatsoever coming out. Now you're going to flip it back to the blue, and you're going to test to make sure that water comes out, which it does. Yay. All right. Now we go back to blue. Back to the air only. Get the water out. We're going to connect our handy, and you can see where there's the solid plastic. That is going to connect to that larger hole there. And then you screw the little collar on into place. Now, you notice my chamber is empty still. You do not want to fill this up until you've run the test for air and water on both the hose and the empty handy. So now that we are still on air, we're going to do this to make sure that air only is coming out of here and that you see no moisture droplets in the chamber. This will never work if you get any moisture whatsoever inside here. So you want to be very cautious about that. I can not see any water droplets, so now I'm going to switch over to water. And I'm going to make sure that water comes out of this. It doesn't actually shoot out the front. It comes down the base, sort of at a 90-degree angle. So I have water coming out of my handpiece just fine. Now I can go ahead and fill up my chamber. So there are two ways. I'm not going to use, remember the sodium bicarbonate powder can only be used in the blue. I guess I'll demo how, no, I'm not going to demo that yet. Please hold. So for the Perio and the Plus powder, this one, this new canister, which I think is what is going to be used for the newer styles that we're hoping to get soon, it does not have the, I'm going to backtrack and just at least demo this part on a blue. If you were using the blue handy and the classic powder, or if we had this style to go into the pink, what you would do in each tub, there's a little cap that goes onto each of the short plastic bottles, and they have a divider in them. So there are two chambers there. You would unscrew the white cap on the back. You can see a silver bar on the inside. That's going to be in both the pink and the blue. That silver bar gets lined up with that space in between the dispenser, like that. And you flip it up, and you pump, and you can see the powder coming out. For the fill, if I would not go above where the base of the cap, right about there. But that's all I'm going to put in on this one since I'm not going to be using this. So I'm going to come out. You put your cap back on, and then you take this off. You don't want to store your bottles like that. You want to unscrew it and put that regular top back on. So that's how you use it if you are using any powders that come in this type of container. That dispenser cap does not attach to this one. It has an opening like that. So for this one, we're going to pour it into our handy. And please be careful because the powder's not cheap. I'm going to pour like this. And you know, it comes out kind of fast, so be careful depending on how much you intend to use. I'm going to put my cap back on the handy and cover back on here. So now what you want to do is decide which tip you're going to be using. So again, you have your option for your Perio tip, which needs the plastic insert, or your regular tip, which says Airflow Plus. Remember, that can only be used with the pink. So that's locked into place, and now you're going to test out your mixture. This is where you're going to adjust your water depending on what you want your slurry to look like. You don't want too much powder and not enough water, because then you're just going to get chunks of powder coming out onto the patient's teeth. But you also don't want just water, because you want the powder there to do its job. So I think I probably have the water set a little too high. to hold this. You don't hold it and operate it like this. You hold it just like you would your slow speed handpiece. The tip swivels. As far as the weight of the cord pulling back, if this is going to be your long-term instrument of choice, I find it useful to sort of wrap the cord in like that, and that way it evenly distributes the weight of the cord onto my forearm versus pulling back like that. But that's just my personal preference. So make sure that you are toggled over to water, and then you're going to spray here. You can see I've got some powder, some water coming out, but I think still maybe a little too much water. So I'm going to come back a little bit on that. You'll also be able to test it out by whether or not the stain and the plaque are being removed when you're air polishing on your pacer. So you can kind of see on the side there some of the powder collecting. So I might have not enough water at that point. So just some little clues for you to know what to look for. That's probably a little better. So that is how you would set it up and get everything ready to use it. And again, I mentioned I'm not going to demo technique because there are a lot of Hugh Freedy videos online for you to do that. So now we're going to talk about breakdown. The very first thing you're going to want to do is completely wipe down your unit before you go. This is really for the skillet valve, but before you go to clean everything up here, because you need to be able to clean this with a clean air water syringe or a clean HVE, clean gloves, all of that. So this is going to come off. It will go in the ultrasonic bath. All three of the tips, whether it's the regular perio tip, this little snub nose plus one, or the regular plus, all three of these can go in our ultrasonic bath, and they need to, because if these have any residual powder left behind in them, they will get clogged and they will not work. So if you go to assemble one and you've tested your lines and you've tested the handy and you're getting air and water, but then you go to assemble this with powder in the chamber and nothing comes out, that probably means that your tip is clogged and you're going to need to get a different one. So set these to the side, and I will show you this at the end, but these are going to ultimately go in the ultrasonic bath. And now my whole unit has been cleaned and wiped. It's beautiful. You are going to empty the powder out of your chamber. And you can do that directly into your trash can. You're going to need, as I said, a clean air water syringe or a clean HVE tip. So there should be a clean air water syringe in each of the bins, but if there's not, you can go get one. I could have sworn there was one in here. Okay, so I have a clean air water syringe. I'm going to set that up here. The reason this has to be clean is because the handy does not get autoclaved. Your tips will get autoclaved. This only gets wiped. You don't want to use a dirty instrument on the inside of this chamber. So that's the purpose behind the clean air water. Please, please, please test to make sure you're blowing only air in, because you don't want to get water in this chamber. What you're going to do is blow out all the residual powder that didn't come out when you dumped it. You also want to get any powder off of these threads where the cap goes. Alright, so that is cleaned out to the best of my ability there. And then you also want to do the same thing to the cap. You want to get the powder off of the threads. So remember, when we wipe down our unit, we wipe the whole handy off. But you can go ahead and give it another wipe if you want. And after you wipe it and the inside has been cleared out, the handy goes back inside the bin. So now we're going to pretend like we have run our tip through. Let's go back this way and take this deal. So the perio tip, if you were using this one, you would have brought that in off the cart. In here, by the tape dispenser, there's going to be a cup. It's going to have the wrench to remove the plastic tip, There's going to be a monojet syringe that we're going to use to flush distilled water through the tip. There is going to be a long, skinny cleaning needle that needs to be kept in the case when it's not being used. And there is this plastic tip which goes down into the barrel of the air polishing tip. So if you're using the regular tip, that would have been brought in on the cart and placed directly into the ultrasonic bath. If you were using the perio tip, whoever is the one bringing that back has to first take off the disposable plastic tip first using the wrench. So that's off. Now that can go. So whoever picked up your instruments, or you may have brought it in on the cart, but this would have been placed into the ultrasonic bath. If you were using the perio tip, you would have removed that first. The regular tip would have just gone straight into the bath. You're going to take those out. You can use either of the sinks depending on what is available, but you'll have to bring your little cup of tools down here if this is the sink you're using. First, rinse it with some regular water. Then you're going to take that long needle that I showed you. There is a small hole down, if you look down the barrel inside the tip. You may or may not be able to see that on the video. Both the perio tip and the regular tip will have this. You're going to insert that needle into the tip and use that to clean any residual powder out. You'll notice the tip comes out, the needle comes out the tip for the true perio tip. It's not going to come out on that regular tip that doesn't use the plastic insert, but you're still going to be able to push it in and out a few times like that. So that is for your needle. That goes back in the case before you put it back into the cup. Give it another rinse with some regular water. Now you're going to use this insert. It says EMS on it. The skinny end of it is going to go directly into the tip. It fits in there nice and snug. And you're going to use your monojet syringe. This is sort of your final rinse on it to make sure with distilled water. You don't want to have your final rinse be with regular water because you don't want minerals to collect on it over time, mineral deposits. So you'll do a little bit of there, got that. And I'm going to do a little bit of a rinse on the outside with some distilled water. You place the monojet syringe inside the opening on the end of that. And then squeeze and you'll see the water come out the tip down there. If water does not come out the tip of this, you know that you have not cleaned all of the powder out, and you either need to run it through the ultrasonic again or use the needle to make sure. But water has to come out the end of it before it can be set aside to dry. So all of that is done. All final rinses with distilled water, and then you're going to leave this to dry in a denture cup down by the ultrasonic unit. You cannot bag this until it has dried. So what you can do if you're in afternoon clinic, you're going to leave it in that denture cup overnight to dry. When you're done using this, please make sure you separate the monojet syringe, kind of shake the water out, and let that sit like that back in the cup, just so it's not sitting together all nasty. So in your cup, you should always have your monojet syringe, the wrench, the insert, and your needle. That's what you're going to use to clean. So after you have cleaned that, it's dry, then you can bag it and autoclave it. And that's how you break down and clean the hair polisher.